Hi, Mike Gibson, Mathieu Kerneis, coming to you from ESC 2023, and we're talking about the ARAMIS trial of a new therapy in myocarditis. Mathieu, talk to us a little bit about what you did and what you found.
Okay, thank you, Mike. I'm very pleased to be able to discuss the ARAMIS trial and to discuss about myocarditis, because the last study on myocarditis was almost 30 years ago with the MTT trial published by Mason in the New England Journal of Medicine. And it's a very poorly studied condition. As you know, it's an inflammation of the heart that can cause life-threatening event, and there is no treatment. There is no specific treatment for acute myocarditis patients. And when you look at the evidence, a strategy of anti-inflammatory drugs or immunomodulation has never been evaluated in patients with unknown viral replication without biopsy. So we did that for the first time with the largest randomized controlled trial in acute myocarditis, testing a new treatment, Anakinra, which is a IL-1 receptor antagonist, targeting the pathway from IL-1 to IL-6 to CRP, during the hospitalization. And we were looking at the number of days free of any myocarditis complication, so a patient-centered outcome. We perform an academic trial, 100% academic trial without any funding from the industry, with the Action Group.
Tell me the number of patients randomized and what you found.
So we randomized 120 patients. It can seem like a small number, but for a myocarditis trial, it's a relatively large number of patients because it's a rare condition. So we enrolled a patient between 2017 and 2021. 61 were assigned to placebo and 59 to Anakinra on top of standard of care. There is no guidelines on the standard of care for acute myocarditis. We define that as a treatment with beta blockers and ACE inhibitors, because we felt that it's a treatment that is given in the vast majority of patients admitted in an ICU for an acute myocarditis. We look also at safety endpoints, the number of serious adverse events related to the drug, hepatitis, anaphylactic reaction, or serious infection. And we enroll patients based on the on simple real-life criteria of acute myocarditis. We wanted to do a pragmatic trial, so the patients were included if they had chest pain, troponin, normal angiography, and a cardiac MRI that put the diagnosis of myocarditis according to the Lake-Lewis criteria. And we exclude all the specific forms of myocarditis, autoimmune, giant cell, eosinophilic, sarcoidosis-related myocarditis. All these patients were excluded from the study. So I think we have enrolled patients with probably viral myocarditis or viral triggered but immune-mediated myocarditis.
Mm-hmm. And what did you find?
So we find first that our population was very young. The median age was 27 without any medical history. The patients were mostly male. 9 out of 10 were men. They had an history of recent infection in almost half of the cases. And we treat them during 2 or 3 days during the period of the hospitalization. At the end, after 28 days of follow-up after hospital discharge, there was no difference between anakinra and placebo on the number of days free of any myocarditis complication. The number of days was, the median of the number of days was 31 in both, 31 in placebo group and 30 in Anakinra group. So there was no difference between the two groups. But when you look at the event rates, it's interesting to see that the event rate of the composite endpoint, which was heart failure requiring hospitalization, chest pain requiring new medication, ventricular arrhythmias, or ventricular dysfunction, the event rate was 10% in the Anakinra group and almost 17% in the placebo group. So I think we are not powered to draw any firm conclusion on that, but it's an interesting signal. And further randomized control studies are clearly needed to explore the potential benefit of anti-inflammatory strategies in acute myocarditis patients, either at higher risk of event, in selecting a population that is at higher risk of event, or larger study with a prolonged anti-inflammatory strategies in patients at low to moderate risk, which is the population of the ARAMIS trial.
Well, congratulations, Mathieu. This looks like an important step in the right direction of carefully evaluating this kind of therapy, generating some provocative hypothesis-generating data. I hope you and others will now pick this up and maybe further explore it.
Yeah, thank you.
Good to see one of my former mentees doing so well. Thank you, Mathieu. Congratulations. Thanks for joining us, and thanks to everyone for joining us here from ESC 2023.